My doctor in Colombia said, okay, I will approve for 6 months. But in the airport, they say you cannot travel with all this medicine.
Jesus Salas arrived in the U.S. with a 1-month supply of his HIV medication, and with it, a heavy dose of uncertainty. Salas had access to care in Colombia, but after moving to the U.S. to be with his husband, he was unable to find a Spanish-speaking HIV clinic or consistent providers in Florida.
No tenemos nada. Venimos a este país, no sabemos absolutamente nada, no encontramos nada.
CDC data shows that between 2018 and 2022, HIV infections overall decreased by 12% in the U.S. It also revealed Latino Americans account for 33% of new cases, though they make up 18% of the American population. HIV stigma, racism, and poverty are a few reasons for disparities in HIV diagnosis and treatment.
This is something that we should all take seriously, all of us, whether we're Latino or not, because this is not just about ending HIV for Latinos, it's about ending HIV for our nation, and we can't do that if we don't address the Latino epidemic.
Salas spent months without reliable care until a friend recommended Pineapple Healthcare, which specializes in HIV care for Spanish speakers.
55 to 60% of our patients are either only Spanish speaking or they're bilingual. We do have a lot of people here in Florida that are immigrants and they don't know about the accessibility for healthcare here.
Nurse practitioner Eliza Otero says the clinic also prioritizes comfort.
So es muy importante que además de educación para romper el estigma, los hagamos sentir cómodos en su propio idioma y en su propia cultura.
You talked about how healthcare is expensive.
Yes.
Yeah, so how were you able to navigate that at the clinic?
Actually, I don't pay nothing. I receive everything. They provide everything.
What is the cost for HIV medication? A month's supply can reach up to $1,300. The clinic participates in a federal drug discount program which allows its patients to receive medication at low to zero costs. More than half of their patients receive financial assistance.
We try our best to get our name out there to reach all the people that the best way we can so we can bring them into care.
In January, President Donald Trump cut nearly all global health funding, including the PEPFAR program, to prevent HIV and AIDS in more than 50 countries. While those cuts don't directly affect U.S. programs, American HIV nonprofits are concerned their funds will be cut if they don't comply with Trump's anti-DEI mandates.
The truth is, when we cut back on resources for prevention and treatment, whether in the U.S. or across the globe, that means we won't make progress.
Pineapple Healthcare is bracing for the fight.
We need to be vigilant on the things that are happening around us and that are affecting us. Right now, we're just getting prepared for everything, to take care of our own staff or take care of our patients.
Salas' experience at the clinic has given him the courage to share his HIV status with his family, and he hopes his story will encourage others to not be afraid to ask for help.
Pensamos que por preguntar tenemos un costo, y no, simplemente tocando una puerta, lo peor que nos pueden decir es que no.